Paul Strickland Scanner Centre is a world-class imaging centre. We've got a team of international level radiologists, physicists and radiographers. We operate as a registered charity. We're overseen by a board of trustees who are all voluntary and give us freely their time and their experience and their expertise. We have been running as a scanner centre since 1985. We were set up by Dr. Paul Strickland, who was head of radiotherapy at Mount Vernon, and he saw the need for cancer patients to benefit from that revolutionary technology of CT and MRI scanners. He just could not believe that they weren't available locally for cancer patients. So with determination and enthusiasm, he single-mindedly set about fundraising, and his initial target was 1.2 million, and he wanted to be able to build a building and have a CT scanner. He raised enough money for an MRI scanner and a CT scanner as well as the building. He exceeded his targets, but he was supported by the local community who also saw the need for such scanners. We're on the site of a world-famous cancer centre, and the interaction between our radiologists and the cancer doctors means that patients here do truly get a first-class service.
PET has really revolutionized the management of our patients with cancer. It has really improved the diagnosis and the staging, the detection of recurrent disease in our cancer patients. And what this really means to our cancer patients is that it enables us to provide our cancer patients with the best possible treatment suitable to their cancers. And also, of course, in some cancer patients, it will mean selecting treatments and sparing them unnecessary treatments which they will not necessarily benefit from. The advantage of PET is that it is much more sensitive than CT and MR for detecting cancer. In other words, it can pick up much earlier cancer compared with CT and MR. But of course, as we know, CT is the imaging of choice with regards to localizing our cancers. So really, with PET-CT, we have the best of both worlds. I think we're very fortunate at the Paul Strickland Scanner Centre because we have state-of-the-art, in fact, state-of-the-art PET-CT scanners. So, what does this mean for our patients with cancer? It means four very important things. Firstly, it means that we can diagnose cancers earlier. Secondly, it means we can stage our cancer patients more accurately. In other words, we can show the extent of their cancer much more accurately, which has a huge impact on selecting the most suitable treatments for the patient. Thirdly, it enables us to diagnose residual disease when they've completed treatment. And last, but certainly by no means least, it enables us to detect relapse of their cancers, and early on enough so that we can try and cure them of their cancers. In this patient, the PET-CT shows the lung cancer in the chest and also shows us the unexpected spread to the bone and also to the liver. I think also this case demonstrates a further advantage of PET-CT is that all this information which is necessary for planning treatment can be obtained in just one scan. Previously, we would have taken at least 2 or 3 other scans to obtain this information. In this patient with Hodgkin's lymphoma, the CT shows a large soft tissue mass in the chest following completion of chemotherapy. Really rather worrying appearances for the oncologist. But in fact, the PET shows no activity at all. reassuring our oncologists that in fact the large soft tissue mass in the chest just represents sequelae of treatment, or what my old boss used to call smoke of battle, and nothing more sinister. The patient has been cleared of their cancer. All that remains is scar tissue. I think it's also important to remember that almost every aspect of cancer metabolism can be studied using PET-CT. For example, here we have used a tracer called fluorothymidine, which helps to study the increased turnover in tumor cells. And it shows us the areas in this breast cancer which has the most active cell turnover. This area is the area which will be biopsied, and the information provided by the biopsy of this area will very much guide our clinical oncologists to provide the most appropriate treatment for this patient.
As a registered charity, our independence allows us to make our own decisions about our investment strategies and what type of technology that we're going to invest in to benefit patients. Our mission statement is to remain at the forefront of scanning technology. We couldn't do that without help and support of people who organise events for us, who run races, who have spring fairs, all sorts of activities that keep us at the forefront of scanning technology that allow us to continue to benefit patients. Celebrating our 25th anniversary is a tremendous achievement, and we are delighted that we are still delivering on Dr. Strickland's original vision.